Alzheimer's disease is a progressive neurodegenerative condition that slowly ruins memory and thinking abilities and eventually ceases a person's ability to complete simple tasks. Alzheimer's is the source of 60 to 70% of cases of dementia. About 1 in 9 people above the age of 65 has Alzheimer's disease. What is Alzheimer's disease? Brain cells die, leading to failure of brain cell connections, in due course destroying memory and other important mental functions. Early onset of Alzheimer's occurs between the age of 30s and mid-60s, however, it's very rare. This disease was named after Dr. Alois Alzheimer, who in 1906 noticed certain changes in the brain tissue of a woman who died of an unnatural mental illness. Her symptoms included language problems, unpredictable behavior, memory loss. After examining, he found out many tangled bundles of fibers and abnormal clumps in her brain. These tangles and plaques are some of the main features that cause this disease. Loss of connections between neurons is another cause for this disease. The damage begins to take place in parts of the brain like hippocampus and entorhinal cortex, then it affects areas that are responsible for reasoning, social behavior, and language. Eventually, other parts of the brain are damaged. Worldwide, over 55 million people are suffering from this disease, and it is assumed that this number will double every 20 years. Causes. Scientists don't know the exact cause of this irreversible disease, however, they believe that multiple factors cause this disease, some of which are genetics. Scientists believe that Alzheimer's disease is caused by the inheritance of some genes, and the risks of this condition being passed on are very high. Research shows that those with a parent or a sibling suffering from Alzheimer's are more likely to be affected by this disease than those who don't have first-degree relatives suffering from Alzheimer's. Aging. The changes that contribute to causing Alzheimer's include inflammation, atrophy, shrinking of certain parts of the brain, production of unstable molecules called free radicals, blood vessel damage, and mitochondrial dysfunction. With age, cells die, leading to tangles and plaques that lead to memory loss, mood swings, confusion, and speech problems. Lifestyle. Lack of sleep, nutritious diet, physical exercise, and mentally stimulating activities are some factors that increase the risk of developing Alzheimer's disease. Pre-existing medical conditions. According to scientists, certain drugs like antimuscarinic drugs and antidepressants have been linked to the development of different kinds of dementia. Signs and symptoms. The symptoms of this disease slowly develop over the years. In the early stages, the symptoms can just be short-time memory loss. As the disease develops, the memory loss problem worsens. In the later stages of Alzheimer's disease, the symptoms increase severely and cause distress to not only people with the condition, but also their family, carers, and friends. Some of the symptoms include memory loss. People start to have problems retaining new information or recalling memories from the past. Cognitive functions. People have trouble learning, reasoning, thinking, remembering, decision-making, and problem-solving when suffering from Alzheimer's. Patients often keep misplacing things and get confused with time and place, dates, and even seasons. Losing grip on reality. Alzheimer's patients are often observed to become paranoid and delusional. Hallucination is also a common symptom. Patients can have trouble understanding spatial relationships and visual images. They might have difficulty with balance and judging distance or determining color or contrast. Behavioral patterns. The brain changes that happen affect behaviors and moods. Symptoms like depression, irritability, aggression, distrust, social withdrawal, confusion, and disorientation are common in Alzheimer's patients. Treatment. Scientists haven't yet found a way to completely cure Alzheimer's, but there are medications available that can temporarily reduce the symptoms. Some options that might help with the symptoms are medications. Aducanumab, it's a disease-modifying immunotherapy drug prescribed to patients with mild Alzheimer's. Cholinesterase inhibitors, these drugs are given to patients with mild to moderate Alzheimer's. This type of medication includes drugs like donepezil, rivastigmine, and galantamine, which work by blocking the action of acetylcholinesterase, which is the enzyme that destroys acetylcholine. NMDA antagonist. FDA has approved the use of the drug memantine as a treatment for patients with moderate to severe Alzheimer's. These medicines help keep the cells healthy by blocking the neurotransmitter glutamate to activate NMDA receptors. Memantine has been proven to improve the daily activities of Alzheimer's patients. Food. Several diets like the Mediterranean intervention for neurodegenerative delay diet and keto diet are supposed to help Alzheimer's patients to recover from some symptoms. Self-care. Many studies show that physical exercise helps to prevent many diseases, one of which is Alzheimer's. Some evidence shows that exercising may directly help brain cells by increasing oxygen flow and blood. Thus, exercising often and maintaining a healthy social life can improve symptoms of Alzheimer's. Prevention. There is no certain way that this disease can be prevented. However, having a healthy lifestyle will help reduce the risk. Cardiovascular disease has been linked with increasing the risk of Alzheimer's, and thus maintaining a healthy cardiovascular system is very important. Eating a healthy and balanced diet that includes fruits, vegetables, and proteins are very important. Quitting smoking and keeping alcohol consumption to a minimum can also help. Exercising at least 4 days a week by doing moderate intensity exercises help prevent many diseases. After 30, everyone should get a full body checkup once a year because the symptoms of most diseases develop early on. Diagnosing early can help with a lot of problems to develop into a worse stage. Staying mentally and socially active is very important. All the above helps to prevent not just Alzheimer's, but many other diseases and help with living a long and healthy life.